in Scotland, actually, the trend is the same, but even more rapidly. So there's a 73% rise in the number of people going for self-paid private procedures since the pandemic. And there is a smaller increase, but still significant for insured patients, so those who might have healthcare through their employment and so on. But 73% rise in the number of people who are paying out of their own wallets to have a procedure privately in the years since the beginning of the pandemic, so the last 3 years. And the UK average for self-pay is about 1 in 3 private procedures are paid for in cash, as opposed to through a policy. It's almost half in Scotland. So we know that NHS waiting lists are, I think it's 25 times higher in Scotland than in England. So it does show that link between, where the NHS is struggling, people are making that personal choice to go into their own coffers. And in Wales, similar, 20% of Welsh patients are on waiting lists at the moment compared to only 5% in England, although Wales is doing a better job of bringing it down quicker than we are in England. But it is a higher percentage.
And I think also the amount of time, I saw some statistics that the amount of time people are waiting in Wales is shorter.
Yeah.
So
higher people on the percentage
England's
of the population.
prioritising basically the people, England is prioritising to an extent low-hanging fruit to get the waiting lists down, but that doesn't necessarily mean...
Yeah. The Welsh Government doesn't collect data nationally on those kind of private sector referrals about who's paying in what way. So there was a recent FOI request that established that data is not in one place. Yeah. But, same trend. I think this is interesting compared to the Republic of Ireland, actually, where they have a completely different system. It's kind of a mixed economy. You do pay into to receive medical treatment, but your payment depends on your income and outgoings and so on. So depending on your economic status. Yeah. So it's you pay to see a GP. It's much easier to see a GP. You can see a GP the day you want to see them, no questions. And you can get a routine procedure pretty easily. Of course, you're co-paying part of that. But they don't have great acute care outcomes or more significant things, so cancer and so on. Their survival rate is not as high as in England. So that kind of mixed economy, which some of this suggests, if attitudes are changing so radically, we might be shifting towards, it doesn't always have the best outcomes for the big issues. Yeah. So you might feel better on a day-to-day basis. You might get to see your GP and not have this pent-up frustration that the case studies that Zoe was talking to have. But then if you get cancer, your chances of survival are lower.
Yes, and there was a little bit of that in the data you looked at, Zoe, that, the vast majority of people were using private healthcare for small procedures that make a big difference to your quality of life quickly for not a lot of money. But does that defund then a service that should be there for the big stuff? So to wrap this up, Zoe, it's now quite common for Tories to respond to talk of existential threat to the health service with, well, Labour always say that before an election. And it is true. So is there a little boy who cried wolf thing going on here? Has the threat lost its sting through overuse? Or is there a way to galvanise people into supporting the notion of a universal healthcare system free at the point of use?
So my worry with the NHS is that we constantly hear that the NHS is on the brink of collapse, don't we? So every winter we hear, if there's a big flu pandemic, a big flu outbreak this year, the NHS could crumble. We hear that all the time. And there definitely have been individual trusts that have been in crisis. And obviously the pandemic, we had to lock down to prevent the NHS from literally falling apart. But people seem to have a short memory, or perhaps, as you were saying, we've just heard it one too many times and people don't really... It doesn't have the same ring to it now. When we talk about how the Conservatives have run down the NHS over 13 years, it's like, okay, yeah, we hear that all the time, but a lot of people don't know what that looks like in practice, right? Yeah. The pandemic could have been a great opportunity to sort of galvanise that support around the NHS, but again, it just sort of
feels wasted opportunity.
It does. So it's a really difficult thing. I think what Labour really need to do is to keep talking about the NHS, right? Yep. To keep that political appetite up for reform. I think one of the things that worries people is they're like, do we just have to keep throwing money at this? Is it destined to? Is it, you know, too big now to keep up with the needs of an ageing population? You know, the cost of public services. If Labour can genuinely present a vision of an NHS that is still free at the point of use, it still ticks all those boxes, and it's, you know, better and it's sleeker and it's reformed as well as had some money spent on it, I think you could re-galvanise people and get people excited about that thing that once brought the country very much together. But at the minute, it just feels like crisis after crisis after crisis, and I think people just don't know what to do about it. And I think actually part of that has been maybe a slightly deliberate attempt by the government to make it sound like it just has to fail. You know, it's constantly failing. Because they don't want to spend the money on it that it requires.